personal services sector with a targeted phase 1 reopening. I'm going to introduce our panelists, and then we're going to go into screen sharing facilitated by our presenter, Alita Ostakovich. So first of all, I would like to introduce Alita Ostakovich. She is with the Emergency Management Coordination at Washington County, and currently she's also the Emergency Operations Center Liaison. Lloyd Purdy is from the city of Tigard. He's Economic Development Manager. He is partnering with the Chamber to bring these series of webinars to our business community. Frank Brown is also online to answer any questions that might come up that are within his area, and he's an environmental health and licensing supervisor, also with Washington County. And I am Debbie Mollahan. I'm the CEO of the Tigard Chamber, so we are helping facilitate this. And Jessica Love, who you don't see, but you see her name, is helping actually run this webinar for us and live stream it to YouTube. So with that, Alita, I think we can start screen sharing.
All right, wonderful, thank you.
So as I talked before, what we're going to cover today is health, safety, and sanitation related getting ready for phase 1 reopening for the personal services sector. So we're not going to discuss when is Washington County going to reopen. There actually has been an update to that, and Alita is going to be sharing that. We will take questions at the end of the webinar. And so what you're going to want to do is, if you kind of hover your mouse or your finger around the bottom of your screen, depending on what kind of device you're using, you should see a little Q&A function pop up, and there you can type in your questions. And so at the end of the presentation, we'll then start going through those Q&A questions and providing answers. Any questions that we get that are outside of health, safety, and sanitation focus will not be answered. That's not kind of our area of expertise with this panel. And if we're not able to get to all your questions, we will take them offline and get an answer in writing, and we'll post it to the Chamber and the City of Tigard websites. I also want to remind everyone that we are recording this webinar. It is currently being live streamed on YouTube. And when this is done, you'll be able to download or view a copy of the recording of the webinar, as well as download the PDF of the slides. So that's for you to go back and check things out, or to share it with a colleague or anything like that. So with that, I'm going to hand it over to Alita.
Thank you so much. Good afternoon, everyone. So as Debbie mentioned, my name is Alita Ostakovich. I'm the EOC Liaison Officer. And today we're going to talk about reopening guidance for personal services. So throughout the PowerPoint, I will talk about reopening the county, reopening considerations, PPE needs, online resources, and then open it for a Q&A. We always start our presentations with a disclaimer as well. So this information is current as of 5/21/2020. As you are probably aware, the situation is evolving rapidly and information changes. So the best place, I think, to stay up to date is on the governor's website. So that's coronavirus.oregon.gov. So to get started, in terms of reopening the county, we are currently in what is called baseline, which is pre-phase 1. But we are submitting our application to the state tomorrow with the goal of reopening on June 1st. So we're currently working on our final criteria out of the 7 that we needed to apply, which is contact tracing. We were told by OHA that we didn't need to have all 100+ contact tracers in place for us to apply. So as long as we're on our way, we've got enough to start it, and we have our system in place to do the contact tracing, we can put our application in, and that's why we're putting it in tomorrow. In terms of contact tracing, we contracted with the Oregon Public Health Institute starting at the beginning of this week, and they've been working really, really hard to go through all of the interested applications and hire contact tracers. And we should have our first group of about 20 contact tracers ready tomorrow to start training on Monday. In terms of the approval process for businesses, we've gotten some questions about this. There actually is no county approval process in terms of when you can reopen, other than waiting until phase 1, right? So you don't have to send us plans. You don't have to get an application into the county and get an okay. If you are one of the businesses listed in phase one, once we announce that we are in phase one, you can start opening. So I wanted to go through, I've broken down the presentation into the guidance requirements from the state versus the guidance recommendations, so that it can be really easy for us to see what needs to be implemented and what are some best practices and good ideas to think about. I also have a number of questions later on in the presentation to kind of get you thinking about what you need to plan for, what you need to acquire, and how you can start preparing now for when we open in phase one. So to get us started with the guidance requirements, the first is that you need to operate on an appointment-only basis. So you cannot allow walk-ins. You need to screen clients before each appointment. So this means contacting the client prior to the appointment and asking if they have a new or worsening cough, a fever, or shortness of breath. And then also asking if they've been in close contact with anyone who is COVID positive in the last 14 days. And so in this instance, close contact means within 6 feet for longer than 15 minutes. So if a client answers yes to any of those questions, you have to reschedule their appointment for another time when they are not feeling sick. You also need to keep a client log. So you need to record client contact information, the date and the time that they came for your service, the provider for each of the clients. And in this way, keeping track will allow you to help the county if a contact tracer reaches out to you because somebody tested positive and they visited your location. That way you have the information quick and easy to find. You need to limit the number of overall providers and clients in the business. So our target here is to make sure that every pair of client and provider has 6 feet of distance around them. So determining what stations you can use, how you can reconfigure your layout to provide that space, and then how many people can actually be in there while keeping your distance. When a client comes for their appointment, they need to wait in the car, and you can do a text system, a buzzer system. You can have somebody come out and knock on their window, but you can't have people congregating in your wait room. And then you also have to assign one provider per client throughout the entire encounter. So you can't switch providers halfway through a service or have one person do a service with one individual and go get something else done with somebody else. So one person has to help them the entire time that they're there. You also need to ensure 6 feet of distance between pairs of providers and clients. So we kind of touched on this. So in many of these personal services, you can't keep distance between the provider and the client themselves, right? Unless somebody has 6 feet of hair and you're trimming the end. But you do need to keep 6 feet between your station and whoever you're working next to. You also need to post signs about COVID-19 symptoms and physical distancing. So have those in areas of the store where people are likely to look at them. You must remove magazines, newspapers, service menus, snacks, and beverages from the waiting area. So those that can be commonly touched surfaces that are really hard to clean and they can carry the virus. So removing them from your waiting area will be one less touch point that somebody could possibly get infected through. You need to provide face coverings and proper PPE to employees. So in terms of PPE, the guidance document from the state goes into more information on when you would need gloves, when you would need a face shield versus a surgical or medical mask, and then when you can just use face covering. So ensuring that you look through that guidance so you know what the proper PPE for your providing service is would be really great so that you can start applying or buying the PPE before we open. Only use soft or porous items once and then discard. So an example of this would be like a nail file or one of those rotating blocks that you put on an electric nail file. So something that can only be used one time before you discard it. You also have to provide training and education to your employees. So there are a lot of new guidance out here and employees are going to be the ones who are actually doing a lot of this. So making sure that they have the training on proper hand washing, on how to conduct a screening, on getting people from the car, all those different aspects that need to be implemented, we also need to educate employees about. You're required to wash your hands before service and also ask the client to wash their hands as well. And then you need to wash your hands after using the phone, computer, cash register, or credit card machine, and then wipe any of the machines in between use. You need to clean and disinfect all tools and linens before closing for the night. And if you have any products out, they need to be kept in a closed container. Any that aren't in a closed container need to be discarded and replaced with a new product. In terms of recommendations, so this and the guidance are the best practices and things that you can do further to keep people safe. So the requirements you must do, the recommendations would be an extra step. And so examples of this would be use plastic covers over cloth seating. So cloth is not a surface that is easily disinfected or cleaned. So by using cloth or plastic covers, you can clean it easier. Discontinue the use of a paper appointment book or card. So switch to an electronic system, which you can wipe down easier and doesn't keep germs as much. Limit the exchange of cash and wash your hands after every transaction. So if you have the ability, maybe switch to a cardless only system, and that way you have less products passing hands. Use a touchless thermometer to check temperatures of employees and clients. And then wear a face shield in addition to a face mask when you're doing a face-to-face service like a mustache trim or brow waxing. So many of your services, you can keep some distance, not fully 6 feet, but then there are other services like the mustache trim or the brow waxing where you really get up close and personal with your client. And so in that case, it's a good idea to double up on the face protection that you're using. You can ask clients to wash their hair before coming to an appointment. It's recommended that you can change into clean clothes in between clients if the service requires extended close contact. If you're in there for over an hour, 2 hours doing a service with somebody, you can change your clothes just to make sure that none of those germs are sticking onto your body. You can provide hand sanitizer at all work locations for employees and clients. So one thing to note here is that the guidance does say that you are required to provide hand sanitizer and tissues, but it doesn't talk about how much you need to provide. So the difference between this requirement and recommendation is if you're going to have 1 or 2 hand sanitizer pumps around your facility versus having one at every single station. Now, some questions to start thinking about in terms of our reopening considerations. So for preparing your facility, you might not have been operating for a while, so your business might have been closed. So you want to make sure that the premises are in good order so that your lighting works, that you have the garbage and refuse areas cleaned, that your toilets work. You want to post your signs about COVID symptoms and spread, and also think, do you need them in any other languages? Do you have clients that come in that would appreciate a non-English poster to get their information through? Do you need to laminate your service menus or switch to a wall menu? So instead of offering paper or something that people touch often, can you laminate it so it's easier to clean? If you put it on the wall, nobody touches it, they can just look from a distance. Have you determined which stations need to be closed to maintain a 6 feet of distance? In terms of employees, have you purchased the face coverings you need for the employees, or do you have a plan for acquiring these face coverings? Have you provided education to your employees about mask use, client screening, client expectations, new sanitation practices, things like that? Do you have a protocol to check employees' health and hygiene practices? Since rigorous hygiene and hand hygiene is really forefront to our reopening, do you have a way to show your customers that or check to make sure people are actually following those rules? Do you have a contingency plan for higher than normal levels of absenteeism? So one of the aspects to our reopening and the contact tracing that's occurring is really rigorous isolation and quarantine. So if one of your employees had come into contact with somebody who is COVID positive, they would have to quarantine themselves for 14 days. So you might be seeing higher levels than normal of people not being able to work. So do you have a plan to make sure how you can continue operating if you don't have as many staff? And also, do you have a plan to make sure that you're working really diligently to keep that 6 feet of distance? Because the better we physically distance, that means the less staff could be part of a close contact who would have to quarantine for 14 days. And are you planning for staggered breaks, arrivals, and departures to reduce possible gatherings? So if you have a locker or a break room that people tend to stop in either to sign in or to put their things away, staggering the arrivals and departures will make sure that people aren't bumping into each other or in close contact. And then staggering the breaks will make sure that in your break room, people aren't clustered together. So in terms of clients, have you developed a plan for communicating with your clients about your expectations? So you'll need to message them about the fact that they need to wait in the car, that they should wear a face covering, that you would like them to pay with credit card, and that there are new hand washing procedures. Are you using Facebook? Are you putting it up on a sign when they come in the door? Are you emailing it to them when they schedule their appointment? So how are you letting them know what is expected when they come into your store? And then do you have a method for taking appointments and documenting client information? So many of you probably already have an appointment system, but the client information aspect might be new. Are these two separate books? Will you be keeping them together? Do you have an online system that you're using? Is it in the cloud? So different considerations like that. In terms of products, do you know how you'll handle laundering? Have you looked at the CDC guidance for how they recommend to do laundry? How are you going to disinfect your commonly used items and locations? So do you have the proper cleaning product? Do you know what'll work to disinfect these areas? And are you planning to use thermometers to screen clients? Remember, that's one of the recommendations, but not the requirements. So if that's something that you want to practice, have you purchased the thermometers? Have you located a good touchless thermometer to minimize contact with individuals? And then some general considerations. Have you identified the high touch areas in your store and a plan for who and how often they will be cleaned? So have you looked around your store and identified all those locations, the counter in front of the cash register or the doorknobs or the nail polish rack that'll need to be sanitized and cleaned often? And then who will normally do this? Is it the employees? Is it the owners? And are they aware that this is going to be their new job? And in terms of how often you clean, you also need to think about how you'll remind people. So are you going to use a bell? Is it going to be at the top of every hour? Is somebody just going to know after they get off their break every day that they need to go clean? So considerations like that. And then the last thing to think about is if you have a break room or a bathroom, and creating plans for cleaning and socially distancing in there as well. So in terms of PPE needs, personal service providers must provide their own PPE for reopening. So a question around this we touched on a little earlier is, do you know what PPE you need to operate? And do you have a supply chain that you normally go through? Can you access PPE that way? I think it's a little hard for some people to get PPE right now because it is a national and even global issue that we're facing. So Busines Oregon has put together a portal and a list of dozens of different manufacturers and vendors. So if you're looking for PPE, you can head to their website and search through to find what'll fit your needs. I mean, just also a reminder we touched on earlier, but businesses must provide face coverings for their employees. So Washington County is working on creating a similar list to that portal that Busines Oregon has, but that'll focus just on cloth face coverings. So you can see who locally and in the region is creating and selling cloth face coverings. In terms of some online resources, this first bullet point is a really great resource when you're trying to determine what cleaning products to use. So it is an EPA website that just gets longer every day. I think one of the good things about COVID as a virus is that it's pretty wimpy compared to a lot of our cleaning products. So the list is really long in terms of what you can use that'll be effective, and even a simple bleach solution can do it. So when you're looking for a product, something to note too is that labels will say on it like, oh, it's effective against X, Y, and Z bacteria, but that's not going to have a label yet for COVID-19. So using this list from the EPA is going to be the best way to determine if your products will be effective. And the reason that it doesn't have that label yet on the product is just because we're moving so quickly and it's only been around for a couple of months. Nobody's had time to redesign a logo or a sticker and add it to their product. The second bullet is a reopening survey, which is also created by Busines Oregon. And this allows you as a business owner to go on and share any of your client expectations, so that you have to wear a mask, you have to wash your hands before you come. It'll allow you to choose what county you live in, what type of services you provide, and then any special other considerations. So say you're only operating from 7 a.m. to 2 p.m. on Wednesdays and you want people to know that, or if you have special hours for vulnerable populations and you want to put that out there. So this survey will then be created into a public facing dashboard individuals can go use and search through before they go out shopping, so they know that they can be prepared and be a good customer when they come to your store. So we talked about the COVID related posters that you need to have in your store. I've got 2 links to show you some locations where you can go download and print out already created posters. The first is our Washington County site, and the second is OHA's site. When you go to OHA, I think the posters are really great, but it's a little hard to get there. So once you're on OHA's site, if you scroll down about halfway, there'll be a sign that says Governor's Guidance and OHA Recommendations. And then there will be a box that says OHA Signs Guidance. You press that one, and it's about halfway down that box. I put in here Busines Oregon Small Business Navigator because I think that's a really wonderful resource and a great location to start any search that you have if you're looking for specific information. So they have information on work, employee support and financial support. They have information about reopening. They even have a phone line, which you can call that can be translated into multiple languages if you have any questions and need support. And then as always, in addition to the guidance that you're receiving from the governor, check out your licensing agency because they might be putting out additional guidance or additional best practices that can help you prepare and operate safely. I'm going to turn it over to Debbie now.
Thank you, Lita. So here are some more online resources that we've put together for you. So these first set of links is what's coming from the Oregon Health Authority. So it's focused on personal services. So this gives you the PDF. You can actually click that and find out a refresher on what all those requirements are from OHA. And we added the link because this might keep getting updated. So we didn't want to give you a hard document, but actually give you the link to be able to go to the State of Oregon site. We've also provided a link for the mask and face covering guidance because that is another document. So those two kind of work together. There should be a hyperlink in the personal services sector guidance that takes you there, but we're also just providing this link for you. And then there's also general employer guidance that all employers need to comply with. So this also gives you a link to that PDF. If you're looking for sanitizer, and you want to shop local, you can do that and actually support one of our local businesses. If you're familiar with Rose City Distilling, they actually make whiskey and vodka and all sorts of different things. And now they're also making sanitizer. So these are some links to check out their pricing, order forms, and their point of contact. So this is for bulk orders. And then, as Alita already mentioned, this is a link for an ongoing list of PPE providers. It seems to be growing. I think there's about 100 providers listed on that, and that is being constantly updated. And then Alita talked about signage. So this is just an example of some of the signage that you can get either off of the OHA website or from the CDC. So in the upper left, there is a sign that says why sign in. And so this is something that would be very useful for personal services because you're going to need to keep that log and have people sign in and be able to keep track of them. There's also the clean hands and washing your hands signage. And then here's also the COVID symptoms signage. So this just gives you an idea of what is available. So you should be able to download those, print them off. If you want to laminate them, because typically a laminated sign is going to hold up better, particularly if it's something you have on your door. We're going to be getting a lot of traffic. And then you could also be able to clean those off. So there's a lot of things out there for you already. You don't need to create them. And then we also received some resources from the Oregon Office of Emergency Management. And these actually came in the form of a PDF that were shared with them. So one is the CDC cleaning and disinfecting decision tree. So it takes you through kind of a decision-making process of how you should clean and disinfect. There's another CDC document that is overall reopening America guidance. So it covers business, it covers homes, it covers schools and a bunch of other things. And then if you own a building or you haven't been in your building, as Alita was talking about, BOMA actually put together a really good checklist and things to think about in terms of preparing your building for re-entry for your employees, yourself, and your customers. So now it's your turn, and we're going to take a look at what questions have come in through the Q&A box and work on answering those.
Debbie, can you remind everybody where they can find those links that you were just sharing?
So we're going to make a PDF of this PowerPoint presentation, as well as a video recording, and it will be hosted on the Tigard Chamber website on our blog page. So you just go to our main page and click on blog, and it'll take you right there. You can also get the video off of our YouTube channel as well, because we're streaming it there and it'll be recorded there as well. So
First,
what questions do we have?
yeah. So first question is, are the signs required?
Yes.
No matter, okay. Perfect. Thank you. And then is there like, what kind of signs can you cover, just like briefly, a quick checklist of what signs are required again?
Sure. Post signs listing COVID-19 symptoms, ask employees and clients who have these symptoms to stay home. And then the other one is about social distancing and how to maintain 6 feet of distance.
And that one sign for the symptoms is already available through the OHA, so you wouldn't have to recreate that sign. You could just use that one.
And there is also an OHA sign on 6 feet of distancing. We just didn't include that one because we ran out of space on the slide.
We've already touched base on this, but do you have any recommendations on where to look for PPE?
Yeah, so I think Business Oregon's website is the best place to start and go through that list because it has so many resources.
Thank you.
Mhm.
If we have physical barriers between stations, would that allow stations to be 5.5 feet apart?
You know, the guidance doesn't say anything specifically about that. So from a county standpoint, I can't answer that. I think it comes down to what your leadership determines based on the guidance and how to keep people safe.
And ideally, the 6 foot criteria is 6 foot. It's not 5.5. So I hate to kind of put a delineation of exactness on something like that, but it does say 6 feet is the distancing. In other conversations we've had about restaurants where they have booths and they have very high backs, but they're not 6 feet apart, that they cannot use those. So if that is a reference, then I would suggest that that not be the way that that would happen and be okay.
And then for clarification, linens must be changed after each client, not just daily, correct?
Correct. Yep, and you need to provide a clean cape for everybody for each new client if that's part of your service. And you need to wear a clean smock with each client if that's part of your service.
And then how do hair dryers factor in to all of this? They're specifically asking, don't they make the social distancing less effective? But just in general, I know that there was conversations about how hair dryers work with COVID and stuff like that. So do a touch base.
I will not take that question exactly, but I'll go ahead and see what I can answer with this. And that I don't think we know exactly. I apologize for not having a great answer. We can research that one a little bit more and see what we can find out. It's funny that that topic was discussed in one of our group meetings earlier, and we don't have a totally clear answer to something like that. We'll have to look at that a little bit more and figure out. I just want to mention though, on kind of a side note too, and maybe in conjunction with this, if you're thinking about airflow in your facility and good ventilation, that's going to really help no matter what your processes are that you're doing, whether it's, of course, nails or a perm or whatever. If you've got some good airflow, that's going to help get fresh air in and pull air out. So that's just something else to kind of keep in mind, but we'll have to look into the and obviously I don't use one, right? A hair dryer thing. So.
Yeah, and I think I would add on to that is that's why we put our disclaimer at the beginning that this information is always changing. So when this guidance came out, it had nothing about hair dryers and their use. But as we learn more and as OHA produces new guidance, that might change.
Cool. And then you just mentioned this, but I'm just gonna still go for it. Is it possible to get smocks instead of changing clothes between clients? So then you said that they would be required to change smocks between each client, correct?
Yep.
Cool. And then.
Yeah, and just one more thing before you move on to that. The changing of clothes in between services, I can keep looking through my guidance, but to my knowledge, that was a recommendation, not a requirement. So if that's how you and your staff feel more comfortable and safer, then you can do that, but it's not required. And nobody's gonna come sit in your lobby and make sure everybody has a change of clothes 2 or 3 times a day.
And then this business will be taking temperatures of each of their guests as they come in. Do they have to keep record of the temperature?
That is a good question. And I don't know it right now. I can peruse the guidance while we move on to the second one and get back to us.
Very cool, thank you. 6 feet distancing, but those of us who cannot distance, massage, hairstylists, boudoir photographers, don't have, if they're one-to-one. So how does social distancing work when you're just one-to-one with a client and you?
Yeah, so obviously those types of services you can't do social distancing, and the same thing even if it's a hair salon or a nail salon, your provider has to be close to you. So it's between you and the next group of provider and clients. So when you're in a one-to-one situation, that's when you start thinking about if you want to have a double layer of protection or if you want to change your clothes afterwards. And to go back, there is nothing that says that you need to record that somebody has a fever or their temperature, but if you do take their temperature and it is above 100.3 degrees Fahrenheit, then you cannot provide services.
Yeah, that temperature taking activity is a screening activity that you'll want to do to help provide a safer environment. And, if someone is ill, then you would want to have them not come in. So you're going to have records of the people that are coming in anyhow, generally, because it's almost all appointments. But you do not have to write that down, but you would just say, thank you, thank you. But unfortunately, this looks like you're at above 100.4, right? Is that correct for the temperature?
Oh,
And so, yeah, and so we're going to have to say, come back when you're feeling better.
And then the questions that are required to be asked before the appointment, is that the day before or at the start of the appointment? Before the start of the appointment?
The guidance doesn't specifically call out when prior, so that's a decision you and your organization can make when you're making your policies and your procedures.
I would highly recommend that you evaluate your people like as or before they come in the door. So as much as possible, that moment is the important time in ensuring wellness and that kind of thing. If somebody has had symptoms in the past, I think they want to follow some of the guidance about, staying at home until you're feeling better. So there's a lot of really good health self-assessment on even our webpage about symptom checks. Almost every one of the medical providers have that kind of thing too. So I would really recommend that they try to ask those questions like before someone comes in the door, but not like 24 hours before someone comes in the door, probably within an hour or so of that process happening, so that you really have a real-time assessment of health as much as possible at that moment. That's a recommendation too. That's like Alita said, that's not in anything, but I'm just thinking about what you're really wanting to capture at the time to make sure that you're providing the safest environment to your customers and to yourself, that kind of thing.
Cool. How long do you have to keep records for?
I believe it is 60 days after the appointment.
And is there rules on how to discard them?
It just says information may be destroyed. So I guess it depends on what type of system that you're using. If it's on paper, you might go with shredding because it's a little more secure. And then if you're on the computer, putting it not only just into your recycling bin on your desktop, but then emptying out the recycling box.
And I would also note that there are guidance for retention of records depending on the type of service that you're providing to. So you want to make sure you follow that industry standard as well. And I believe that the Secretary of State's office has a record retention criteria. It's very long. So if you're going to take a look at what that is, but a lot of you in the industry already know, like tattoo and body piercings and stuff, you're going to keep records, I believe, a little bit longer than that for any of your clients. But in certain circumstances, it's going to have a little variability to that answer.
In a situation where two clients need to be rinsed at the same time, and shampoos are not 6 feet apart, we've seen other states use plastic curtains that can be sanitized between. Is that allowed?
We're going with the 6 foot.
Yeah, I think that goes back to what Frank was saying earlier. The guidance says you need to maintain 6 feet of distance. It doesn't say 6 feet of distance unless you're wearing sweatpants on a Tuesday and you're walking backwards, so stick to what it says and do that as well as possible.
And that's another thing I was thinking about, and not that I go to a salon, but at one time I did when I was younger and had more hair. But I remember that a lot of times somebody shampoos you and then somebody cuts your hair. And I think that's why that recommendation about maybe having somebody wash your hair or at home, they wash their hair and then come in, because that involves two service providers. And that's something else to think about. I think especially like in a spa where you might go in and have your hair done and have your nails done. So you're going to have all these different folks involved. And I think we're really wanting to try and think about one person encounter if at all possible. So that just came to my mind as we were having that conversation. And I think you might be thinking that way as well. So it's just something to think about when it comes to that type of business model.
We're getting a lot of questions about smocks and clothing and all that stuff. So one question is, do smocks have to have long sleeves? And then the second one is, instead of a smock, can an apron is an apron appropriate?
So in terms of those, neither are called out in the guidance, so I can't provide an answer to that, unfortunately.
And that fell in the recommended bucket versus the required bucket, right? For smocks.
That's in the required.
Okay,
So it's required to wear a clean smock and required to put a clean drape or cape on each client.
And then for the questions that are asked in advance, do they have to keep a record of the answers of those questions?
No, nothing in the guidance says they need to keep record.
Do we as business owners have any liabilities if a client gets the virus from our salon?
I don't know the answer to that. Unfortunately, I don't work in law, and I think I would suggest turning to a lawyer if you can to find that information out.
And then is facial waxing such as lips and chin allowed?
To my knowledge, yes. And that's one of those cases where you're having really close contact with the client. And so it's recommended that you double up on the type of personal protective equipment that you have. So a face covering and a face shield.
Do massage therapists have to use gloves when massaging?
Let me peruse the guidance.
And then Debbie, can you mention again where while you're looking through that, can you
Yes.
mention where the links are going to be at again?
yes. So if you go to the tigardchamber.org website and you go to the menu bar at the top of our website on the main page, you'll see a link that says blog. And if you click that blog link, you will then find you'll find an article with both the video and the slide deck turned into PDF available for you. So you can either rewatch that video, you can go watch it on YouTube, and you can download that slide deck. And all the links, all the hyperlinks that are in the PowerPoint will convert in the slide deck, so they'll be clickable for you. We're also creating a landing page with a lot of the specific sector guidance, general employer guidance, those types of things as well. So once that page is live, there'll be an easy way to get to that off of our website as well.
In terms of wearing gloves, it is part of the recommended but not required to wear disposable gloves when providing client services and change gloves between clients. So it doesn't specifically call out massage therapy, but all services that you could provide, you can wear gloves and change them if that is what your business decides.
And then do you know if photography in a studio is allowed in phase 1?
It hasn't specifically been called out. And again, as the county, I can't go through and say, yes, you can, no, you can't. So unfortunately, my answer to that is to review what's on the governor's website. And based on that guidance, if you think your business falls into one of those categories, you can operate.
I think based on the governor's order, which I'll try to validate this while we're online, I don't believe photographers were specifically called out as you must shut down. So kind of in between that essential and you must shut down category, but you need to comply with the general employer guidance and those types of things. But I will try to go off and validate that while we're answering the rest of these questions.
And then let's see, just going through the comments real quickly. We have gotten some questions which we're not answering because it's not within the health and safety field, but we've gotten some questions on waivers and liability. So Debbie or Lloyd, do you have any recommendations on resources or where to go?
I can only say that
With
Debbie
your
and I,
insurance agent.
that's good. And I know Debbie and I talked about having some more of these sessions with different areas of focus. So if we see that legal questions keep coming up, we can try to find a way to bring in an expert. I don't know if we can do it timely, but that's something we can try to do.
And not that this is necessarily my area of expertise, but you might look at industry associations for assistance in this type of thing, because a lot of times they're going to have, you know, liability conversations and forms and response plans that they put together, a lot of times in conjunction with other experts in either law or business. So that would be another resource that you might be able to use.
Very cool.
So in looking at the governor's order back in March, the 20-12 that originally identified businesses that had to shut down, photographers were not listed in that set of businesses that were required to shut down.
Then I would say any business who is operating now or in phase one needs to comply with guidance. So even if you don't find guidance that's specific to your sector, they have general guidance and you need to be physically distant as much as possible.
And then where would you recommend people to go to get more advice on what specific information on PPE that is required, like specific information about smocks and masks and all that stuff?
I think your licensing agency might be a great place to start. They already know the ins and outs of what you do. They've already been working on requirements pre-COVID. So I think that they're best to handle questions now in this new COVID world.
I believe that is all of the questions that we have currently. Oh, one more. Hair and makeup artists, phase one or phase two?
Personal service.
Are you part of a salon?
I'm assuming no. It's like freelance. So like wedding hair and makeup, going to someone's house, photographer getting their photo shoot done, where it's not in a salon.
I would reach out to your licensing agency for that as well, because I think that's getting really into the nitty-gritty and nuances of what the definition of a personal service provider is. And since that's not laid out with the state guidance in front of me, I think your licensing agency can help you navigate that better.
That is all of the questions that we have so far.
So are there any other burning questions out there that you guys would like to ask? If so, type them into the Q&A box and we'll do our best to answer them.
And I just would like to put in a plug. I tried my best to go through what is required and what is recommended, but this is a really in-depth document from the governor's office. So I recommend downloading it and taking 20 minutes to peruse it and really read it in depth. I think that's going to clarify a lot of what you need to do and what are recommended for your practice.
While we're waiting on any last questions, I want to take a moment and thank all of you for the work you've done, the gathering of important information, your willingness to share it with us through this Zoom meeting. I appreciate Alita and Frank from Washington County, Debbie and Jessica from the Tigard Chamber. Thank you again for making time for this, bringing your expertise to this. This is one of the best of these webinars we've had. Everyone's gotten to be a better program and a better presentation. So thank you for that as well.
And as our audience, you had the most questions so far of all of our webinars, and the most attendance. So nice job. We realize this is probably one of the more complicated sectors because you're up close and personal with your clients, and there's a lot of concern around that. So hopefully this helps you navigate through that. And again, we'll be posting all of that content. It's like maybe we have another question. Oh, 2 more questions.
We're just getting compliments now.
Oh,
And thank yous.
someone said they're most concerned about ventilation. So I don't know, what I comment on is what I've seen, at least with our restaurant sectors that have been open for pickup only because we were under such severe constraints, is a lot of them, depending on how their business is set up, are leaving like doors and windows open to get a lot of good cross ventilation. If you've got fans, you might consider that as well. So they're exhausting, towards the outside realize every business is different and you might not have windows that open or a front and a back door, but I think getting creative about that. If you're in a building that you lease, I would recommend talking to your landlord to see if there's anything they can do for you, or make sure the, AC and furnace filters are replaced on a regular basis to improve airflow and ventilation and those types of things. Because a clogged up filter is not going to let the air flow through your facility nearly as well as a clean filter. I know that from personal experience.
I saw the most recent question that came in about information and when it comes out. The state, Washington County, the Tigard Chamber of Commerce, and the City of Tigard all have resource pages where we're posting the most current information we have as soon as we get it. So those of you on the call still listening, you've got lots of, maybe more than you need, places to turn to. The State of Oregon, Washington County, Chamber of Commerce, City of Tigard, and of course the Fed agencies as well. So we're trying to keep these resource pages as up to date as possible.
And that's also why we were provided a lot of it in hyperlinks. So as those documents get updated, it should hopefully take you to the latest document that's been updated, particularly by OHA.
If you have any difficulty accessing any of those links or anything, though, I would take your call. Try to help you out so that if you're not able to get to something, you have no computer or something down, just reach out to somebody or your association or call, and we'd be more than willing to try to assist you in some way of getting that information to you. I just wanted to also mention really quick, and thank you everybody. This has been very helpful and good. We talked a lot about cleaning and frequent cleaning. So it might be one of these situations where you have somebody that's just going to be their job for a little while. So, or somebody that knows for the, from 2:45 to 3 p.m., they're going to be running around and cleaning all of the surfaces like on an hourly basis. So it might be useful to actually have that. And I think, Alita, you talked about that. It's funny, I point at my computer screen. She probably can't tell I'm pointing at her, but I do. So anyhow, it might be good something to just think about, and again, I know Alita talked about training folks, but how are you going to do that? It's a good idea to kind of think about okay, before they come in, I want to make sure these folks have information. So I get an email, can I text them, or do I need to call, or whatever? Or how can I go through that kind of information? And there are lots of resources available on Washington County's webpage and also on other sites of just watching those videos about how to wash your hands, and those kinds of things. So how to put on a facial covering, so know that there's some resources and you want to try to get those to the staff ahead of time so that you can start on the ground running when you get back open.
I do know one of the things that one of our restaurateurs shared with us was that they were going to use the recorded video of the restaurant sector webinar as part of their training for their employees as they move to a phase 1 reopen. So that was going to be part of the requirement, was to watch the webinar, even though a lot of it, they in theory probably should already know many of those things because they're in the food industry, but there was some good things, and that way they don't have to recreate it. They can just leverage that content. So that might be something in the personal services sector you could look at doing as well for your employee base, to say, hey, go watch this webinar.
Okay, I think, again, thank you. I think we've exhausted the questions.
Yes, it looks that way.
Hopefully we haven't exhausted our business partners tuning in. Thank you everyone for joining us on the Zoom meeting. Thank you again to our technical experts and panelists. We have one more of these scheduled for next week, focused on professional services, bookkeepers, accountants, lawyers, and as Debbie mentioned, we've already been through a session like this for restaurateurs and one for retailers. So plenty of good content. You'll have access to the recorded version of this via the Tigard Chamber of Commerce website. It'll also be available on different links through the City of Tigard website. Okay, one more question. I just saw it pop in. If it's relevant, we'll take it, and then we're going to wrap this up. Jessica, was there one more?
Yeah, it's therapists.
Therapists count as professionals. Absolutely. Thank you for that. Okay. Thanks again, everybody.
Goodbye.
Bye. Thank you. Thank you to all the panelists.